Do you consider yourself a high achiever? Smart, driven, highly successful? I am so excited to have you. My name is Julia Arndt and I'm the host of the Stress Podcast. I will help you develop your stress resilience the same way you've developed your workplace superpowers. Learn peak performance tools to thrive at work and in your personal life. Let's get started. Hi, everyone, and welcome back to the Stress Podcast. I am super excited to welcome our next podcast guest to the show, and it's Warren Kane. Hey, Warren, how are you today?
Hi, I'm doing well. Thanks for having me on.
Yes, I'm super excited to chat with you today. But before we get into all the things, there's three simple questions that I always ask all of my podcast guests. And the questions are, what did you do when you got up this morning? Where are you located? And what time is it?
Yeah, no worries. So what I did early this morning was take care of my son. He's actually just 3 months old, so he gets up every couple hours. So that's what I was doing all this morning. I'm currently located in Las Vegas, and it's 10:09 a.m.
Great. Thank you so much for that update. Yeah, that's how old is your son exactly?
Yeah, so he's almost 3 months right now, so still trying to get through the night.
Still finding a routine with that, I'm sure.
Yes, trying to.
Yeah. And then tell us a little bit about yourself. What do you do in your day-to-day?
Yeah, I'm actually a psychiatrist here located in Las Vegas. I have my own private practice, and I see different types of people struggling maybe with anxiety, depression, or burnout. Yeah.
How long have you been doing that?
I started my practice back in July, but I've been seeing more patients. I would say I started taking patients primarily in November 2021. So it's been about 8 or 9 months now. It's been really great.
Very nice. And one thing, the first really interesting question actually that I have for you that I'm sure a lot of people oftentimes ask themselves is what is the difference between a counselor, a psychologist, and a psychiatrist?
Yeah, absolutely. So I think that's a great question because here in America, I feel like we often get the terms kind of confused. But with the psychologist versus the psychiatrist, I'll start there. But a psychiatrist is a doctor who's gone to medical school. So I went to 4 years of medical school, and then afterwards I did 4 years of training, and then I became a psychiatrist. A psychiatrist commonly prescribes medications, but they're also able to diagnose any kind of mental health disorder or psychological disorder. So we're good with diagnoses, we're good with medications as treatments, and we're also trained in therapy. Psychologists are primarily PhDs or individuals who've gotten a doctorate in psychology, and they primarily provide therapy or kind of counseling to a certain degree, but they primarily provide therapy. And counselors don't necessarily have to have a PhD. Commonly, they can have other types of degrees, but they also do therapy with clients as well, too.
And can psychologists then prescribe medication, or is that just really limited to psychiatrists?
Yeah, in America here at this time, I would say 99% of the states or 90% of the states, psychologists cannot prescribe medications. It's primarily just psychiatrists.
Very interesting. And so you were saying, you're obviously treating people for burnout, for anxiety, for depression. Can you tell us, I think, there's always this common confusion, I think, about, what is the difference between between burnout, anxiety, depression? Because I always say when I was diagnosed with burnout, but at the time in 2018, I was actually going through 2 different questionnaires that I had to answer, which were on anxiety and depression.
Yeah.
And I was diagnosed with anxiety and depression because burnout was only recognized as an official disease by the World Health Organization in 2019.
Yeah.
But I'm pretty sure that what I had was more, burnout, was workplace related, high levels of stress, which burned me out, which then gave me some type of, anxiety and depression, I guess. But can you tell us a little bit more about what the difference is there and how we can maybe know that it is more burnout versus maybe a clinical depression?
Yeah, absolutely. So I'll try to explain it the best that I can. But as you mentioned, burnout technically isn't a medical diagnosis per se, although it's recognized by the WHO. But as a psychiatrist, as a medical provider, we commonly use something called the DSM-5 to help diagnose individuals. And it's basically a criteria for any type of psychiatric disorder. And at least at this time, burnout is not included within that manual. So technically, we're not able to diagnose people with burnout, but that doesn't mean burnout. Yeah, it doesn't mean burnout isn't something that's real and it's a phenomenon out there. And as you mentioned, the WHO describes burnout as related to a chronic workplace stressor that isn't resolved, right? And in my opinion, burnout is kind of a risk factor to anxiety and depression, right? And so on any given day, we're always feeling a sense of burnout. I don't think it's we're burnt out or we're not burnt out. I really think of it as a spectrum, right? On any given day, we're somewhere along this spectrum of feeling less burnt out, more burnt out. And once we kind of hit like the extreme amounts of burnout, there's kind of this point here, we may then kind of enter the anxiety and depression, right? So I think it's more of a risk factor.
And so can you tell us again a little bit about anxiety and depression? And I think what I've heard before is that depression has maybe certain signals that are also recognized in burnout.
Yeah, no, I think all the symptoms kind of overlap and intermix, because I've had clients come to me who are feeling burnt out, and then they may also have depression and they may also have anxiety. But when we think about depression, there's a common symptoms that we think about, and I like to just mention to your listeners out there, everyone is going to experience depression differently. There's mild versions of depression, there's severe versions of depression. But when we think about depression, people commonly think about sleep, right? Am I sleeping too much? Am I sleeping too little? Is this abnormal as compared to how I normally act on a day-to-day basis? Their interests or their things that they may love to do, they may get less enjoyment out of them right now. And the clinical term is called anhedonia, but that's just a lack of interest in things that you would normally get enjoyment from. You may also have feelings of guilt, low energy. Your concentration may be also pretty low. Your appetite may be too high, too low. You may feel like you're moving slower. And in worst cases of depression, people may actually have thoughts of wanting to hurt themselves or other people. So that's something to be very aware about. And so a lot of those symptoms, when we talk about energy, concentration, right, and maybe even feelings of guilt to a certain extent, those really kind of overlap with burnout too, right? When we're feeling burnt out, we're going to have negative thoughts about work. We're going to be feeling more fatigued, more tired. And so it's important to kind of make that distinction, but also realize there's some overlap.
Yeah, super interesting. And so, as you obviously know, mental health has become such a huge topic over the last couple of years. And I'm sure as you were going through your education, it was probably almost linear to right, more and more people talking about it. I'm sure with COVID as well, right, with the pandemic, more and more people are becoming aware of mental health. What has been your, observation with just maybe more people being affected as well?
Yeah, I would say my observation, I think you hit the nail on the head with it being kind of linear. Since the pandemic, more people have been talking about mental health, which I think has been great, right? I feel like the stigma of mental health is slowly getting chipped away, although it's still there, slowly getting chipped away. But more people are seeking treatment and more people are willing to get treatment too, right? And so I think that's really great for the field of psychiatry, for the field of mental health, and more importantly, for people just in general.
Yeah, absolutely. So how can we take care of our mental health? What are things and steps that we can do in order to really be more aware of our own self and maybe recognize the signals early? And maybe let's start with that actually. What are the early warning signals that we might head into a burnout?
Yeah, so the early signals that you might head out into burnout are commonly going to be related to how you're feeling, right? And so again, usually people who are feeling burnt out are going to have some level of fatigue. They're going to have some thoughts about, should I be switching jobs? Should I not be switching jobs? Their initial reaction is going to be like, something feels different and I don't know why. And usually it's, I'm not getting enjoyment out of work. So those are typically the most common symptoms of burnout. And what's interesting is those symptoms kind of develop over time into a couple different things. So you may be feeling a little bit more tired, a little bit more, not wanting to do the work or not really, identifying with the work that you have. what we know with burnout is that it slowly turns into kind of cynicism, right? You
Mm-hmm,
may
mm-hmm,
then start, feeling like, or people may notice that you're maybe not as nice to customers, or you're not
mm-hmm,
really working well with your team members, or now you're having negative thoughts about the work that you do. Like, it's bringing me no meaning in my life. I really need to kind of move on, and things along those lines. And after you become a little bit cynical, people ultimately just become ineffective at their work, right? We become so burnt out, we
mm-hmm.
become so fatigued, we're just not able to complete our work on time, or we may not be doing it as effectively. So those are some of the things that I think about.
Mm-hmm, mm-hmm. And that's really interesting. All of the things resonate obviously super deeply, because, I work with clients on a one-on-one coaching basis, and obviously with groups as well. And that's oftentimes kind of those first signs, right? You might start to question if the job is right for you, and you think, oh, maybe, I feel like you make kind of the external environment responsible for how you feel. And you think, oh, if only I would have a better manager or a better project, or maybe work for a different company,
Mm-hmm.
all of my problems would be resolved. I think what's really interesting is you've talked a lot about kind of more like the mental, right, those signals. What about the physical side? What kind of physical symptoms could people experience when
Yeah.
they start feeling burned out?
Yeah. Some of the physical symptoms that I would say most commonly are just you feeling slower. So some people tell me they just feel slow when they get up in the morning. No longer do they have the energy to kind of move, to get started on the day, to kind of even shower, or to get their daily hygiene. They're just feeling exhausted. And so what's interesting is, medically we call this kind of psychomotor slowing, right? And so
Mm-hmm,
that's
mm-hmm,
one thing to kind of be very, be aware about. And usually what's interesting is we as individuals don't really notice it, but our family members may notice it, right? So your significant other may be like, oh, are you okay? Is everything okay? Are you having any
mm-hmm,
pain? You're moving slower than usual, right? Or
mm-hmm,
they may kind of point that out. So a lot of times people may be feeling that way. Another physical sign, again, kind of listening to yourself, is maybe your appetite is much less, or maybe much more. And so
mm-hmm,
you may realize that you're gaining weight, or you may be losing weight. And both of them are related to burnout too, right?
mm-hmm.
Some people just cope with eating, other people cope by not eating.
Mm-hmm. Yeah, super interesting. And the things that I've heard as well is that, obviously, as we're in this heightened state of stress at all times, and we're in the fight or flight response, all of the main bodily functions are reduced to minimum functionality, right? Your immune system, your cardiovascular system,
Mm-hmm.
your digestive system. And so effects on all these three can also be signs that something is up, right?
Yeah. You may be feeling more sick to a certain degree too. So
Mm-hmm.
yeah, absolutely. Talking about the immune system when you're in a chronic level
Mm-hmm.
of stress, yeah, it can
Mm-hmm.
definitely hit
Mm-hmm.
it hard.
Mm-hmm. Mm-hmm. So what can we do when, so we, I think I really love this episode, and I really love this conversation, because I think it's so important to just continuously talk about burnout awareness, and making sure that we understand, how can I actually take care of myself? What are the signals? What do I need to maybe pay attention to? And I think what you were saying, all of the things, make so much sense, right? Like, we are not really excited about our work anymore. We're starting to question it. One thing that really deeply resonated with me that you said was, you don't really know what's going on, but something doesn't feel right. And that's actually how I describe how I felt in 2018, because I always say I didn't feel like myself anymore, but I didn't really know what was going on, right? Like, I had
Mm-hmm.
like anxiety, I had some digestive issues,
Mm-hmm.
that were all kind of these indicators. And I was obviously constantly questioning if the job was right for me, and all these different things. So now that people are more aware of that, right? The listeners now have all of this information at hand. What can they do? What can we do in order to really take care of ourselves?
Well, so one of the things that I commonly talk with my clients about is like this idea of work-life balance, right? And I really hate the
Mm-hmm.
term work-life balance,
Mm-hmm.
because I feel like trying to balance something as complicated as work and as complicated as life, it's a no-win situation, right? And so one of the things that I really tell my clients is try to focus all your energy on more life than work, if possible, right? Now, of course,
Mm-hmm.
everybody has their own situation, but actively trying to seek that imbalance in a sense. can really help people gain more of a balance, right? And so when we think about focusing more on life, what I talk about is getting to know yourself, right? And so one of the key things that people talk about out there is just meditation and mindfulness, right? Trying to understand who you are. And this is one of the tips that I talk about, is just really reflect on your achievements, on your goals in life, and on what you want to do. And so often when we're asked that by other individuals, like, what do you want to do? Or what are you good at? Or things like that, we give an initial response, right? And sometimes it's just kind of a recorded, message in our brain that we just give out. But really taking time, maybe several days or several evenings to really just kind of come to yourself and kind of know yourself a little bit more and revisit your values. Can be really impactful, really powerful, because our values and our goals in life change over time, and they're dynamic, right? So that's usually the first thing that I tell clients.
Yeah, really interesting. So getting to know yourself better, and I think it's always all about that awareness, right? About okay, there is something going on. What is it really? And to create some space to actually sit with that. What is then the next step? So once I've identified the values, what is the next step, or a different step, or something else that we can do?
Yeah, well, common thing that I talk about is once you kind of understand yourself, what I like for clients to do, to just have more positive affirmations about themselves, right? Is when they reflect on, let's say, reflect on 2021, right? Write down everything that went right. And you can write down some of the things that went wrong. But commonly when we think about ourselves or think about how things have gone in our lives, we really focus on the negatives way too much, right? And so what I really like to tell people is to try to shift their mindset, try to focus more on the positives in their life. And again, it kind of, it kind of relates to burnout in a sense, because when we're feeling burnt out, we become cynical, we become involved with all of the negatives affecting our lives. If we can start thinking about the positives or the things that we do enjoy about our life or about our work, right, it can really shift our mindset, right? So that's usually what I recommend.
Okay, so practicing gratitude, I'm hearing loud and clear.
Yeah.
Especially because, what I call peak performers are tending even more maybe than other people to like look at the negative things in life, or like be very critical about where they're at in their career. So yeah, that's something that's really helped me as well over the last 4 years to really shift my mindset, and also to in more challenging situations always also see the other side. And I think that shift in perspective has been something that's been really powerful for me.
Yeah. Another thing that I commonly recommend to people is just spend time with yourself. And it's a little bit different from meditation and mindfulness. But what I mean by time for yourself is every day, carve out some time for yourself and to do what you need to do to kind of feel well and feel better, to kind of recharge to a certain degree. And a lot of people have time during lunch, right? And so during lunch, instead of worrying about what you need to do in the afternoon or what you could have done better earlier in the day, maybe just go outside and connect with nature. Do a couple breathing exercises. We build up stress during the day, and if we can take breaks during the day, or there's some dedicated time, we can really lower those stress levels. So long term, we don't get burnt out, we don't hit that critical point, or we may actually end up, helping relieve our anxiety or depressive symptoms too.
Yeah, that's a really good one. And I think one of the biggest things that people always struggle with is to find that time, right? And I think to have that experience, wow, if I actually do take a break, I'm actually more productive and more focused and concentrated afterwards. And I think that's really a shift. I think almost a cultural shift, but also obviously a shift in your own personality almost that you have to test out. That's something that took me so long. And I've become, I feel like the more busy I get at the moment, I'm in a very busy state, and I've been sharing that with my community as well. And really the big thing that has helped me kind of continuously be, have maybe a higher workload over the last few weeks than I usually have, is really by taking these mindful breaks during the day, but also in the evening, mindfully disconnect and, do things that really recharge me.
Yeah, absolutely. And speaking of recharging, we ourselves can recharge, practice different exercises that can really recharge our battery. But another thing too is we have a lot of supports generally where people can kind of help recharge us too, right? And so what I really encourage my clients is to kind of find those people in your life that recharge you. Now, there's some people in our lives that kind of take away that energy. So don't be with them. but it could be family members, right? Or old friends
Mm-hmm.
that you've had or lost connection with, rekindling that relationship, right? Things that kind of bring you enjoyment and can help you live a more fulfilled life. It's important to have these connections. And I think in COVID and pandemic, right, we've really noticed how lack of community has really affected
For
our
sure.
well-being. Mm-hmm.
Absolutely. Yeah. Yeah, totally. It's interesting that you say that because I'm, for example, I am an introvert, but I'm also an extrovert, of course, in a sense. But I really recharge by myself. Like if
Mm-hmm.
I really want to like recharge my batteries quickly, I know I need like the best way to do that is actually being by
Mm-hmm.
myself, and
Mm-hmm.
setting that boundary with my partner as well and saying, hey, I just need like an hour, just leave me alone for an hour and I just need to be by myself, because for me, just talking and like
Yeah.
exerting energy that way, like takes energy away from me. So I think it's really important to recognize whatever you need, right? And I've talked to a
Mm-hmm.
friend actually yesterday evening, and she said, I'm an extrovert and I actually get energy from being around people and talking with people. So it's really interesting. And it doesn't matter. I think, even if you are an extrovert and you feel like maybe you need a little bit more introverted time, or if you're an introvert and you need more extroverted time, there's no right
Yeah.
or wrong, as long as you are consciously choosing what you need.
Yeah, absolutely. And it goes beyond people too, right? Sometimes we recharge with nature, as I mentioned, or some people just
Mm-hmm.
recharge with like animals and their pets,
Yeah.
right? And so,
Mm-hmm.
like, having that dedicated time, knowing yourself can
Mm-hmm.
really go a long way.
Mm-hmm. Do you have a recommended time? Because I think oftentimes people think, oh, we need like an hour or 2 hours, and I don't have an hour or two to recharge. What is there like, medically or from a research perspective that you say even 10 or 15 minutes are enough to do that?
Well, I'm not as familiar with the like quote unquote scientific evidence out there, but what I commonly
Mm-hmm.
tell people is just start off by taking a little bit of time for yourself. Because
Yeah.
as you mentioned, the clients that I work with, they don't have an hour, they don't have an hour and a half, they can't
Mm-hmm.
dedicate evenings, they can't dedicate mornings. So I say, you know what, just carve out 10 minutes a day, right? Just start
Mm-hmm.
off with 10 minutes. See how it impacts you. Start getting to know yourself a little bit more. And if you find value in those 10 minutes, which I believe they will, right?
Yeah.
Then they'll start going to 15, 20, 25 minutes. As we start to understand, the importance of
For sure.
healing ourselves, being with ourselves, we tend to give it priority more.
Yeah, for sure. I say that too. If you start to feel that effect, then it's more likely that you're going to do it in the future as well. How do you recharge yourself as a very young parent?
Yeah, yeah. For me, of course, being a physician, there's a lot of stress involved to a
Yeah.
certain degree. But
Mm-hmm.
what I do really enjoy is just spending time with my family, right? And so
Mm-hmm.
spending time with my wife, spending time with my new son, or even connecting with family has been really great. And we just go on
Mm-hmm.
walks, or we'll just go ahead and talk, or it could be as simple as, just making dinner together, right? And
Mm-hmm.
just
Mm-hmm.
being together. That's what really recharges my battery and helps gets me motivated for the next day.
Very nice. Um, what about any other tips? So we talked
Mhm.
about taking time for ourselves, right? Taking mindful breaks, being aware of just the signals, and maybe especially in these moments where you feel very overloaded, to kind of counteract that. What else can we do to take care of our mental health?
Yeah, one of the most interesting things, and it's very simple to do, and there is some evidence behind it, is just saying three things that you're grateful for right before you fall asleep, which it
Mm,
sounds really silly because it doesn't really take too much time. But if you can say three things that you love that day, that you're grateful for that day, science has shown that the following morning, if you continually do it, you're going to feel less anxious, less stressed,
mhm,
less
mhm,
depressed. And this is just a simple thing other than taking a medication or going to therapy that you can do, right? And so
mhm,
again, it kind of goes back to earlier in my conversation or earlier in our conversation where we talk about we don't really focus on the positives that happen to us in a given day,
mhm,
right? Or in our
mhm,
lives. And if we're able to give more attention to that, that can really, really help people.
mhm. Yeah, totally. That's a super great tip. And yeah, I'm actually kind of curious as well, as a psychiatrist and as
Mhm.
being able to actually prescribe medication when people come in with anxiety and depression or any other mental health related disease. What is your stance on medication?
Yeah, well, so my stance is a little bit different from other psychiatrists out there. I'm of the firm belief of medications only if needed. I feel like a lot of people out there are
Mm-hmm.
medicated, overtly medicated. And,
Mm-hmm.
maybe it's not appropriate, maybe it is appropriate, but it's always important to talk to your own professional to kind of get a better understanding. But from my point of view, whenever a client comes into my office, I ask them, first of all, of course, how they're feeling, how things have been going, what is their knowledge of what's been going on. But more importantly, I talk about their goals and values. I have some clients come in who say, you know what, doctor, I don't want any medications. Absolutely. I hate them. I've had poor experiences to them in the past. I feel like, I couldn't trust my prior doctor. And I really try to engage with them in that conversation, try to understand why. For some people, they just don't know much about the medicines. And I talk with them about them, how they work, and what the long-term plan is with them. For other people, if they're really opposed to it, we talk about other types of things that can improve our mental health. So like the strategies we talked about, or we talk about different types of vitamin supplementation, or we look into their blood results a little bit more to see if there's any other causes for the anxiety and depression. So I try to treat people holistically, integratively, and again, just really trying to respect their values and their autonomy, right? So many times in America, people are going to the doctors, it's 15-minute appointments. They're never explained the side effects. And, even for me, I would be really hesitant to start any medicine, right? If I didn't really
Yeah,
know what would
100%.
be the impact, right? So, yeah.
Yeah, I'm really glad that you're saying that, because I always think that medication is almost just like a band-aid for something that we have to look closer at, and where we have to make a bigger, just kind of a bigger decision, right? It's not just I'm taking that pill and I'm going to be forever better. There's actually a root cause of why you're feeling the way you're feeling. And it is super important to address it at the root instead of just taking a medication to make you feel better about it.
Yeah, I don't think medications are the only solution out there. Commonly, when I talk with my clients, is if we're going to pursue a medication, let's do it with therapy as well, too, right? Because I agree, understanding a little bit about yourself, about the causes, about how things can improve in the future, having what we call in the medical field insight, right, into our condition. Again, can be super powerful, super impactful, and help them get out of that rut that they're in right now, right? So when we look at the evidence, medications plus therapy are always going to be more beneficial than medications alone.
Yeah, for sure. I have a really good example actually when it comes to medication and just, doing that, because I actually currently have a really bad toothache. I'm going to see a dentist this afternoon, but I, even with pain medication, I'm like very careful to take pain medication, because I'm like, well, obviously something is going on with my tooth and something needs to get fixed, right? Again, like there's a root cause to that pain. And if I would just take pain medication, over the course of the next 2 or 3 weeks, I might feel better in the moment, but it's, there's obviously something wrong with my tooth and something needs to get fixed. So that's kind of always how I think about medication. Or even when I have a headache, right? I'm like, well, I could just take a pain med in order to have the headache go away. But I'm asking myself, am I maybe dehydrated, or maybe my sleep wasn't really great, or I'm feeling super stressed and overwhelmed and I have a lot of things going on, and maybe I just need another extra hour of alone time for myself tonight in order to just recharge my battery. So that's really how I think about medication, and like really just listening to your body, what it needs, because I believe that no matter if it is a mental health disease or a physical health problem, there's always a reason why it's happening, right?
Yeah, I would agree. When we think about psychiatry, we talk about the biopsychosocial understanding, and that may be a little bit complicated, but what it really breaks down to is that there's other stressors in our lives, social aspect, that really contribute to how we're feeling. And when we can address those social stressors, right, whether it be relationship with work, relationship with other people, right? If we can kind of get a better understanding of what we can do to improve, or how we can change our mindset, or what changes that we need to make in our personal lives, it can really improve our mental health too. So I agree.
Yeah. And that's obviously, I almost feel like the more courageous thing to do, right? To really look at the problems that you have, or be very honest with yourself about maybe the lifestyle that you've been having, and that's maybe not helping you show up as the person that you want to show up on a day-to-day basis.
Yeah, 100%. Yeah, it requires a lot of energy, right? When we talk about
Yeah.
therapy or we talk about coaching or whatever it may be, that's a
Mm-hmm.
lot of time that we invest as compared to just taking a medication. And so it
Mm-hmm.
requires work. And that's what I
Mm-hmm.
really love about my job is a lot of the clients
Mm-hmm.
that I have that motivation, want to get down to that root cause. And it can be,
Right.
again, really impactful and provide a lot of change for the better.
Mm-hmm. Yeah, that's super exciting. And so you said that obviously you're specializing in burnout as well in your practice. So is that what you mostly see? And is that so? Do you feel
Yeah.
like you're almost a little bit biased in the sense that you feel like a lot of people around you are burned out because that's often the people that you see?
Yeah, maybe I'm a little bit biased, but I feel like everybody's experiencing burnout, right? And the pandemic
Mm,
has really brought to fruition like how severe of a problem it is, right?
yeah.
The great resignation in a sense where people are leaving jobs that they aren't getting any value out of or aren't resonating with and trying to pursue other avenues that they connect with more, right? And I
Mm,
think the term burnout just really encompasses all these feelings that we have. And anyone I talk to on a day-to-day basis, typically, I would say 90% or more have feelings of burnout, right? Maybe they're doing a
mm,
job that they don't enjoy, they don't connect with, they don't, resonate with, right? And again, I think of it more of a spectrum, and other people may not, but I think it's a spectrum.
mm,
We may
mm,
feel less burnout one day, more burnout the other day. So yeah.
mm. And one interesting question that I oftentimes get, and I'm actually super excited to have a medical
Mhm.
opinion about this, is when do you know that you actually need to take some time off?
So usually what I'll say is by the time you figure out you need to take time off, it's already too late, right?
Yeah,
And so
100%.
what I really encourage people to do is that again, maybe it's due to the stigma, maybe it's due to our own values, but even in the mental health field, a lot of people don't reach out until it's way too late. And so,
Mm-hmm.
what I would recommend to anybody is if you even have a hint or even a thought, or if someone even recommends that you take time off, just do it, right? And just
Mm-hmm.
really try to connect with you. Because what we know in mental health is typically when people start developing anxiety and depression, it
Mm-hmm.
usually doesn't get better on its own.
Mm-hmm.
And so
Mm-hmm.
if you're continuing doing the same things that you've been doing, you're continuing to be exposed to all these stressors, you're going to get worse and worse over time. And what does that
Mm-hmm.
mean? That's going to mean more therapy later on, perhaps even more medications or higher dosage
Yeah.
of medicines. And that usually kind of people want to avoid that. So if you can take the earliest hint, or if you are anywhere, if you get any hint that you need to take a little break, just do it, right? So try
Mm-hmm.
to act more quickly rather than, more conservatively, if that makes sense.
Yeah, yeah, totally. And that's really helpful because that's exactly what I talk about a lot as well, where I'm saying, okay, so you're taking that break, but one of the most important things that you can do during that break, besides obviously recharging your own batteries, is to really think about the habits and routines that you have created that have brought you into that cycle of burning out, right? And to really build new habits and routines in order
Mhm.
to make sure that when you're coming back, you're not just going back into the same cycle. Because what I see often as a coach is that people have had multiple burnouts until then
Mhm.
they are like, okay, something is like, I'm all over and over and over again going back into that same cycle, that something else needs to change.
Yeah, and another thing, I think about is not only personal change, right? So the things that we personally do in our lives can increase our resiliency to burnout. But
Mm-hmm.
at its core, if we can try to enact change at the work level, it can be super impactful too, right?
Mm-hmm. Mm-hmm.
So if we can talk to our bosses, if we can try to,
Mm-hmm.
change our day to day, if we can lower our workload, right? These are
Mm-hmm.
things that can really have an impact on how we're feeling and how we're doing. Now, albeit those changes may be more difficult or we may not be in the position to make those changes.
Mm-hmm.
Advocating for ourselves at a bare minimum can go really a long way.
Long way. Yeah, yeah, for
Mhm.
sure. And one of the first things you actually said today was that burnout really relates to feelings. Like, how are you feeling? And I thought it was actually really interesting that you were saying that because it's really individual, right? Like, how do you say that if a feeling is valid or not valid? And
Mhm.
like I think sometimes we obviously, I think, try to maybe seek approval from others as well of how we feel, and if it's bad enough,
Mhm.
to go see a doctor. What do you say maybe to people that don't really know if what they're experiencing is valid?
Is valid. Well, that's a very interesting question. What I would say is, compare it to how you normally feel, if you can do that, right? Some people can, some people can't. The way we're accustomed, or our attunement to how we feel differs on a person-to-person basis. But if you can start to recognize, I'm feeling a little bit different, that may be your early cue to go seek professional help, to seek a coach, to seek a psychologist, or even to go to a psychiatrist, for them to really ask you more questions and do a more thorough evaluation. So that's what I would really say is, kind of understanding that. If you still are unsure how you're feeling and whether that's burnout, what commonly people typically do is they talk to their coworkers, right? Or people that are kind of in the same situation as them, and kind of feel out whether it's normal, right? So you may want to ask your coworkers, are you feeling kind of stressed out right now too? And it may be that time of year, right? If you're a CPA, maybe that time of year where everybody's kind of getting stressed out, and maybe normal to a certain extent. But if people aren't feeling the way that you're feeling, that also might be another cue that maybe you should seek some help.
Yeah, that totally makes sense. Great. Besides all of the great tools that you already shared with us, is there anything else we can do for our mental health?
Well, there's so many things that you can do for your mental health, but I would just say the most important thing is just put mental health a little bit higher on your priority list, right? Start to educate yourself a little bit more about feelings, about yourself, about mindfulness, about meditation. If you can put in the effort, or at least, can put it, more forward into your mind about focusing on who you are and how you are in this world, it can really it can really help you out long term. So that's what I would say is, I would just encourage your listeners out there to continue their journey, to continue working on there, and to continue just, getting educated about mental health.
Yeah, absolutely. That's what I say as well. So thank you so much for really, supporting that message, and for sharing all of the knowledge that you have, because I think it's just always so much more validating to hear from a doctor and hear, what the problems are and what are. I think, oftentimes I always think, even when you were sharing your different examples about mental health, I always think it's really so simple, right? And I think oftentimes people think, oh yeah, it's not going to make me feel different, but if I practice gratitude or take 10 minutes for myself, right? I think because we living in such a complex world, I think sometimes we want to have complex solutions to our problems, and we think, oh, those easy things are not making the difference. But if there's one thing that I've learned, and obviously seen from working with so many people, and I'm sure that you can confirm that as well, is really those simple things are making the biggest difference.
Oh yeah, absolutely. And sometimes the simplest things are the easiest ones to do too, right? And so exactly. I 100% agree, is that sometimes we overcomplicate the situation, for sure.
So why not start with the simple things if they're so simple, right?
Yeah, absolutely.
Yeah, absolutely. Great. Well, Warren, how can people connect with you if they're curious to work with you?
Yeah, they can visit my website. That's going to be a good place to connect with me. It's www.kanepsy.com, which is kanepsy.com. It has my email there. It has what's called my contact information. And I also have a blog as well, where I post some tips that people who are interested can look at. But yeah, that would be the best way.
Amazing. Thank you so much. I'm so happy that we had you today. So thank you so much for your time. And if you are listening right now and you think, wow, this was such a helpful episode, and I know someone, maybe a colleague or a friend or a family member that might be experiencing burnout symptoms right now, don't hesitate to share this episode with them and show them that you care, and help them educate themselves as well. I would really appreciate it, and I think it would just help overall the collective to just be a bit more aware of mental health and how we can take care of ourselves. So thank you so much for listening today. Thank you so much again, Warren, for being here today, and I wish you a wonderful rest of your day.
Thank you.